Good evening and welcome once more to User Manual for Humans Part 9. And for those who have missed the previous 8 parts, they are all on my website and YouTube. So the easiest place to find them is the website. Today we will talk about symptoms and body responses. Are they intelligent? Are they stupid? Or are they random chance? Because most of the diseases, if you go to the hospital or you check a Merck manual or you check the list of diseases and syndromes, about half of them or so, they're going to call them primary or essential. And that means that they have no cause. That is what they mean. They say essential hypertension means we have no idea where it came from. And we've talked about that earlier in a lot of detail. We'll touch on it today as well. Everything in the body happens for a reason. We have to believe and understand that. So we will go through and show you whether symptoms and body responses are intelligent, stupid, or random chance. We'll cover what health is. We'll cover what disease is. We will talk a little bit about ecosystems. We'll talk about adaptation, homeostasis, and allostasis. So big words, but don't worry, they're pretty simple. We've talked a lot about these in previous talks, and if it seems like we're repeating some things, yes, we are. And that's on purpose, because the more that you understand the common theme of something, the more that you will see a common thread that things will repeat. In physics, they're trying to find the unified field theory. They're trying to find one equation that explains everything, because once you found that one thing that explains everything, then you don't have to look much further. And that's basically what we're doing. We're finding the unified field system in the body, if you will. And the biggest problem that we have in healthcare today is the illusion of materialism. And that illusion is that everything that is solid is more real than things that are not. So that means we believe in matter and molecules and tissue more than we believe in signals and information and magnetism and so forth. If materialism is basically when what they're doing in healthcare is they're looking at the physical parts and trying to understand function. And they're looking at effects to try to determine causes. Instead of understanding what cause and effect is, they're starting at the wrong end because they're looking at the physical body. And the physical body is an effect. It's an end result of something else. So here's a question for you. How many would look at the parts of a computer to try to understand why the program is doing what it's doing? It makes no sense, right? You won't do that. And yet, when it comes to health and the body, we always start at the wrong end. So to disperse some of these misconceptions, that's why we do all these different series, and that is the common theme in that we're dealing with. So what is health? The simplest way of explaining health is it's when everything works. Makes sense, right? It's so simple that we miss it. Because the opposite of that means that disease is when something doesn't work. And we'll get back to this, and I'll repeat myself a lot, but I'm trying to drive home some really, really fundamental points. So what is it that we want to work? Well, you have all these variables. You have this biochemistry, you have physiology in the body, you have pH, blood pressure, blood sugar, minerals, you have muscle tone, hormones, and enzymes. They all have to be maintained within very strict limits. If your pH varies even by a percentage point, you'll be dead. I don't remember the exact values, but it's very, very narrow range of values. Same holds true for all of these. Blood pressure, blood sugar, minerals. They all have to be maintained, and something is maintaining those for you. They're not happening by random chance. There's something monitoring and making that happen. And when everything works and is maintained, we call this homeostasis. That simply means, that's a big word, that means keeping things the same. And that is the most important thing about health. And when things like blood pressure and blood sugar start leaving that ideal range, that's when we have diseases. We have cardiovascular disease and strokes and diabetes and so forth. The first part is the body's ability to maintain these variables. The second part is to vary those in a controlled way. So blood pressure at rest should not be the same as blood pressure when we exercise. But once we stop exercising, we want the blood pressure to come back down. And if it doesn't, that is a problem. And that means the body can't tell the difference between stress and rest. And we have to help the body relearn that. So let's talk about some things here. And what we're trying to show you is basically that there is no such thing as disease. And bear with me before you laugh me out of here, because all of you say, oh, well, of course disease exists. We're going to look at it a little bit differently. And we'll see that disease is really nothing more than the body adapting to your environment. It is normal adaptive physiology. So it's not the body that's wrong, but it's something in the environment. So let's look at exercise. It's normal during exercise for your blood pressure and your heart rate to increase. But if the blood pressure stays up without this stressor, then that's called hypertension, and it leads to all sorts of problems. So on the one hand, it's a normal physiological function. On the other hand, it becomes a disease state. You have decreased immune function during stress. That's normal, because if you have something chasing you, your immune system is not going to help you against whatever's chasing. So your body shuts it down. But if it does it when there's no danger around, now you have a depressed immune system, and you're more susceptible to things like colds and flus and pneumonia and even cancer, because all of those are immune system problems. What happens during stress is that your body will stop making as much stomach acid. And that again makes sense, because stomach acid is not going to help you against whatever's attacking you. But if you can't make stomach acid when there's no external danger, now you can't digest food properly. Because there's a purpose that you have stomach acid. Stomach acid is not a stupid mistake on nature's part. It is there to digest food. So if you can't make stomach acid, now you start having things like ulcers and leaky gut and malnutrition and allergies and all sorts of things. So a normal physiological response on the one side becomes a disease or a health problem when it's out of context. What if you go to high altitude? Then your body will start to increase the number of red blood cells. So you have more oxygen carrying capacity, and that's a normal response. It'll start within a few minutes, but it'll take a few weeks for it to complete and find the proper level for that altitude. Yet, if you make those red blood cells without having the altitude, without being at high altitude, now that's called polycythemia, and it's a serious health problem, because your blood gets too thick and it loses some other properties that it's supposed to have. You will have more blood clotting. Your blood clotting ability, like we talked about when you're being chased by something, your blood clots easier so that you can close a wound. But if your blood clots easier when you're not having any reason, now you become more susceptible to strokes and blood clots, obviously. If your insulin sensitivity goes down during stress, that's a normal response, because you want your blood sugar up so you can run away. But if you do this at the wrong time, you're setting yourself up for diabetes. if you can't get an erection with bullets flying around you, that's perfectly normal. Because that's not going to help you much. Right? But if you maintain the same level of stress when the bullets aren't flying, now it's called erectile dysfunction, and you have a problem with procreation. So are you seeing how everything I've talked about is a normal physiological response given a stressful or a certain circumstance, but when we maintain that response in a different context, it becomes a serious health problems. And it even accounts, so far we've covered about 99% of all the diseases that people suffer from. Okay? So I've said this stuff before, but I'm saying it from a slightly different viewpoint to help you see that these are perfectly normal responses. And the problem is not in the body, it's in the environment, and it's in the body's perception of the environment. Hands up, everybody, on all the responses that I described. Are they due to intelligence, stupidity, or random chance? Let's see hands up for intelligence. Nobody's passing. All right. So it is intelligence, it's not stupidity, it's not random chance. These things don't happen for no reason. Okay? So let's see a little more class participation next time I ask, all right? So we're throwing in a cartoon here. This is doctor talking to his patient, and he says, "We can't find anything wrong with you, so we're going to treat you for symptom deficit disorder." I love this guy. Now let's talk a little bit about ecosystems. What is an ecosystem? An ecosystem can be really, really small. It could be an amoeba in a pond. The amoeba is a tiny ecosystem in itself. Your body is an ecosystem. A fish in a lake, the fish is an ecosystem, and the lake is a bigger ecosystem. And our whole planet is a very large ecosystem. So an ecosystem is a place where there's different variables cooperating and all participating in making something happen. And all those variables are necessary to complete the picture to a degree. So now let's say that we have a lake, and for a few decades we've been dumping petroleum and heavy metals and pesticides and toxic waste into this lake. And now the fish are dying, so we can't enjoy our little sport fishing and pull the fish out because they're dying away. How many people here think that we can help the fish in that lake by adding some chemicals to the lake? Okay? You think we should we'll throw in a ton of aspirin or Tylenol in the lake. That should do it, right? They're sick. They need Tylenol, obviously, or maybe they need blood pressure medication, right? Or maybe we can invent some really, really specific chemical that can suppress their symptoms. Are the fish going to get healthier? No. Because they're part of an unhealthy ecosystem. And they're not going to get any healthier until we start reversing the factors that brought the problem in the first place. So why, when we laugh, I talk about the fish and throwing chemicals in the lake, and everybody laughs. Why don't we laugh when we suggest that for humans? How come we think it's a good idea for humans to add chemicals to their toxic ecosystem? Isn't that amazing? And we do it all the time, and we have a $2 trillion healthcare system that thinks the problem is you don't have enough chemicals. There's not enough chemicals in your body. We need to add a few to get you healthy. It's ludicrous. How do you heal an ecosystem? You reduce or remove the factors that interfered with the function in the first place. If it's toxins, you get the toxins out. If it's stress with humans, you get the stress down. If it's too much sugar, too much pesticides, too much heavy metals, you reduce all of those. That's the first step. Then you restore the function to that prior to degeneration. So you have to get the body cells up and working. The brain cells, the muscle cells, all of the organ cells, they need to be helped back up. And that's what we talked about, what chiropractic does. We talked about that in other sessions, that your nervous system needs rebuilding, and that's what we help with. Then you need to provide conditions that support the ecosystem. You need nutrients, water, light, oxygen, carbon dioxide. You need biodiversity and symbiosis and all those good things, which happens, by the way, both in the lake and inside us. You have as many bacteria in your gut as you have cells in your body. There's hundreds, trillions of cells, bacteria in your gut. And they're working with you for the most part if you eat proper food and don't take antibiotics. So it's all about balance. Now let's just talk real quick about homeostasis, allostasis, and adaptation. Homeostasis is simply the ability of the body to maintain values within a narrow range. We're on number 7 here. So an example would be blood pressure. At rest, we want to have a blood pressure of 120/80. We want to have a heart rate of about 55 to 65 beats per minute. And we want to have a body temperature of 98.6 degrees, give or take a couple of tenths. That's normal homeostasis physiology at rest. Then allostasis talks about the ability to change these values temporarily, quickly and temporarily, so that we can deal with what's going on around us. So if we're exercising, our heart rate could go up, our blood pressure could go up to 200/150. At rest, that's a lethally high blood pressure, but during exercise, it's normal. You're supposed to have it. You have to have it in order to get the blood to the body parts that are doing the work. Your heart rate might go up to 120 or 180 beats per minute even, and your body temperature would also go up a degree or so. I put 98.6 to 104. That's not during exercise. That's during maybe an infection. So a bacterial infection could be a temporary condition that allows your allostasis to raise your body temperature to 102, 103, not any higher than 104, because then that becomes lethal too, to deal with that situation. And then adaptation, that's a more long-term process. So in homeostasis and allostasis, you're not really changing your DNA, you're not changing your body structure, you're just changing a few variables around. But in adaptation, now you're changing your body physically. You're expressing your DNA differently to adapt to a new environment. So that means if you go to the gym and lift weights, you're going to put on more muscle so that your body can deal with that stress better in the future. If you go to high altitude, you increase your red blood cells. If you start putting more weight on in the weight room, you'll start building stronger bones so that they can deal with it, and so forth. Let's see a show of hands. Is any of this random chance? Is any of this stupid? Is any of this intelligent? Yes. Good class. So proud of you. And I'm not leading you on the least either. Good deal. So now we go to slide number 8, and this is we'll spend some time here. I'm repeating myself, but we're going to talk about it from a little bit different perspective again. So this is the order of responsiveness in the body. And we'll tie this into, we'll end it a little bit differently so you see the point of this. So if you do exercise, what's the first thing, or even if you're standing at the bottom of the stairs and you know in 5 seconds I have to climb the stairs. then your brain reacts to that reality. It perceives that reality, and it says, we will need more blood. It activates the reticular activating system in the brain that starts this cascade of events, and we need more blood, so we activate what's called the HPA axis. That's your hypothalamus, your pituitary, and your adrenal glands, to make more adrenaline so that you can change your physiology and climb the stairs. And this adrenaline causes vasoconstriction. It makes your blood, the muscles in your blood vessels contract so that your blood vessels get thinner and your blood starts going faster and your blood pressure goes up and the blood goes out to the muscles. That's the whole sequence of what happens from the awareness that you need to exercise until your body has responded with the appropriate physiology. Let's do the one about high altitude. You get to high altitude. What do we know about high altitude? The air is thinner, there's less oxygen. What did you say?
Nosebleeds.
Nosebleeds, there you go.
Ear popping, all that.
Yeah, yeah. And because there's less oxygen, we're going to have less saturation of oxygen on our red blood cells. So that's going to create a deficiency in oxygen saturation. So now the body needs to compensate. What does the body do? It perceives the need for more oxygen. It starts the nervous system talks to the endocrine system and starts a cascade. They release a hormone called erythropoietin. And it's a hormone that you release all the time because blood cells only live about 3 to 4 months, so you need to make new ones all the time. You make billions every day, trillions every day. But at high altitude, you need to make a little more. So your body releases more erythropoietin to stack the odds in your favor. So now you make more red blood cells than normal, and you increase your oxygen capacity, your oxygen carrying capacity. So we have a condition of high altitude that leads to a physiological change, to an adaptation, to a different expression of your DNA, if you will. Let's look at one more, gravity. So gravity causes deformation of tissues. It pulls stuff down. And this gives us the need for bones. If we didn't have gravity, we wouldn't need bones, or not nearly as much of them, rather. We start this neuroendocrine activity and we release something called calcitonin. Calcitonin is a hormone that shoves the calcium into the bones. It makes calcium deposits in bones and it makes the bones stronger. We increase the bone density in response to the gravity. So again, all of these things are normal physiological responses. The body is just perceiving a need and it's responding to that need. But if it perceives this out of proportion or inappropriately, now we have a so-called disease on our hands. If we don't have enough bone density, then that's called osteoporosis, because we haven't put enough weight on our bones, and we may have some calcium imbalances, not so much deficiencies, but rather just ineffective use by the body to deal with it. And it can go the other way too. If we have too much of this response, of this gravity response, then we have other diseases where we make the bones too thick and then they get brittle and they actually don't work very well either. That's called osteopetrosis and Paget's disease and things like that. So everything is about balance in the body. It's about perceived need and about physiological adaptations. Okay? Your body is only responding to what it believes that you need given the situation. Is any of this random chance? Is any of this stupid? Is all of this intelligence? Very good. Very good. barely leading you on at all at this point. Here's the kicker. Here's the whole point of this slide. You see that dashed line across the bottom?
Mm-hmm.
This is when you take a drug, when you take a medication, this is where the drug has its effect. If you take a drug against blood pressure, it goes in right between the adrenaline and the receptor that causes vasoconstriction. So you can block, if you have high blood pressure and you take the drug and the doctor tells you, oh, don't worry about the high blood pressure, we'll just give you this pill and your blood pressure will be normal, no problem anymore. They are not telling you the truth. That should be malpractice, because they're not fixing the problem. They're not changing the body's perceived need. They're not changing the stress response. They're not changing the imbalance. All they're changing is from the dotted line and down. They're blocking the expression. Meantime, your body is just as unbalanced and in as much stress as it was before, and this problem will express itself somewhere else. It is exactly like you're driving in your car and the oil light comes on and you say, well, I don't like that oil light, I'm going to put a little piece of tape on it, or I'm going to snip the wire. The oil light wasn't the problem. So if you block the oil light, if you block the indicator, then the problem will get worse and show up somewhere else, always. Okay? So the same thing holds true for all of these. The dotted line is right between the hormone and the receptor that causes the body response. That's the place where drugs work. And therefore, drugs are appropriate in the emergency room. If you have excruciating pain, if you have broken bones, take some drugs, get out of pain. But the drugs cannot get you healthy. The drugs can only block the expression. They cannot change your physiology for the better. Okay? Now, number 9, we will talk about light and dark. Anybody know what light and dark is? The point I'm trying to make is light is something that has measurable properties. Okay? You turn on the light, you can bring out a light meter. You can measure the intensity, you can measure how many photons are coming off. You can measure the frequency, the color, the wavelength. You can measure all sorts of things about this light because it has properties. Now you go into a dark room and you turn on that light meter or any other instrument, and with darkness there is nothing to measure. Darkness does not exist. We talk about darkness, we believe there's such a thing as darkness, but darkness doesn't really exist. Darkness is nothingness. It's only an absence of light. So this is really crucial. It's really basic analogy, but it's so crucial to get this. Health and function has measurable properties. There's things about health that we can measure. There's brain output, there's electricity, brain waves, there's signals, there's communication, there's all sorts of things happening as a result of proper function. There's facilitation, there's inhibition, things turning on and off. This is function. When all of that works, we have health. Therefore, health is something that is measurable. But just like darkness is nothing more than the absence of light, disease is nothing more than the absence of function. So disease is a made-up thing. It doesn't, just like darkness, it doesn't really exist. It only shows up when something isn't working. Just like darkness is only present when there's no light there. And this is so key to understand, that if you're chasing diseases, you're chasing shadows. They don't exist. You can never get to the source of the problem by looking at the disease. You have to get to the source. So down at the bottom, this is so important. I hope you put this somewhere and frame it and blow it up. You cannot create health by removing symptoms any more than you can brighten a room by removing darkness. I mean, when you look at it that way, it's so obvious, and yet there's not 1 in 1,000 people in this society that understands what I just said, or that knows that before they came here. All right, so brings us to the last cartoon, and Glassbergen is wonderful. Guy looking at a television set, and says, the commercial says, "Ask your doctor if placebos are right for you." And that is the only doctor that I would go to that prescribes placebos. If you enjoyed what we talked about, please let someone know about this. I enjoy doing this, but the greater purpose of this is to provide a community service, to let people know, because most people in our society today die and suffer because they don't understand what we talked about. They don't understand health, they don't understand stress, and they think that pills can do something good for them. And because of this, they suffer and they die by the millions. So getting this word out, even if you are healthy right now, you know 50 people that need to know this stuff. So share the information with them. And that concludes our presentation. Thank you all very much for coming, and I'll be happy to take any questions.